Greetings, juniors. It is time for yet another video lecture, and so wanted to spend some time today looking at reviewing chapters 6 and 7 and planning and implementation in generalist practice. So, buckle your seatbelts up and let's go for the ride. All right. So, as we are thinking about the generalist intervention model, and we have done the engagement, we have done the assessment, it is now start to look at the planning and the intervention. And so we're going to spend some time here talking today. So basically, there are 8 steps that we need to really take a look at when you're looking at doing the planning. One, you got to work with your client. You got to prioritize problems, translate problems into needs, evaluate your intervention in terms of selecting a strategy that's going to work, that you hope will work, establishing goals, specifying objectives, specify the action steps, and then formalize the actual treatment plan. So we're going to walk through each one of these so you will get a good sense of what we're talking about and what's expected. Because this is where you, in terms of your career, will be doing lots and lots of work in terms of planning with your clients. So rule number 1 or step number 1 is, first of all, you've got to involve your client in the planning process. Oftentimes after the assessment and we get a sense of what's happening for an individual or family or a client, we pretty much may know what the answer is or what is actually needed. And that's fine as long as we know that particular piece. However, it's not important until the client realizes that these are the things that need to be different. So it's imperative that you work with your clients and not get ahead of your clients. So you're working with your client shouldn't be you need to do X, Y, and Z. It's about discovering together what the issues are in terms of what the client sees as the issues. Also keeping in mind that the client is the best source of information. They know more about what's happening in their lives than anybody else. And so as a social worker trying to understand that, it's going to be very important that you involve them into the process as well. So it's a client-driven perspective, not your perspective, but what the client sees are the important things and being able to identify those things as well as identify who your client actually is. Second, you're going to need to prioritize your problem. So very seldom will you enter or engage in a situation where you've got a client who's got one problem. There'll be multiple problems, compounded, complex issues that are sometimes interwoven together. So really trying to figure out and prioritize with the client about what are the most significant issues that are facing you. And also being able to state them in terms of an explicit behavioral term. So you need to be able to specify these are the things that you have identified that are the problems that we need to work on, X, Y, and Z. I also threw in the adage here about the air, water, and food. And I think we had a conversation in one of our labs, but it's a prioritization tool that I developed some time ago that helps you as a social worker look at problem situations in the clients that you're working with in terms of the areas of importance. The air being, we can live only a few minutes without air. Water, we can go for probably about 5 to 6 days. And then with food, we can probably last as long as 2 weeks. So if we think about problems in this context, we think about air issues as critical crisis issues that often involve immediate safety or high levels of risk for the client right now. So if I don't do something right now, as it relates to this situation, there could be a huge problems. An example might be if I got a client that I'm talking to and they're threatening to commit suicide. That's an air issue because it's immediate safety, and all of my energy then goes towards resolving that particular issue. Water issues are less severe in terms of immediate risk for families. These are potentially intermediate to long range kind of issues that are going to come up for a family that will need to be addressed, but may not need to be addressed right now. So in other words, I've lost my job. I'm into month 3 of my unemployment and I'm managing and doing things okay. We know that in 6 months though, when the money source is all gone, then we're going to have an issue. So it's important for us to plan during the time that we have to actually look at figuring out ways to replace that income that might be lost. And then if we're looking at food issues, these are issues that are actually even more longer term. So these may be issues that families need to deal with. Let's say I've got a person who has a child who is in a residential facility receiving treatment, and they've been there for 6 months, and in 6 months they're going to be coming home. And so we need to be planning for what that return home looks like for this kid. They're probably going to do some aftercare. We've got to also set up services and get ready to reintroduce this kid back into the family. So it's not an immediate issue that needs to be addressed, but 6 months from now it's going to be an issue. And so we need to look at things that way. So just a little tool to kind of help you think through when you're wondering about what needs to happen. Second, you need to be able to translate the problems that you hear from your client into an actual need. And typically, problems, needs are just the opposite of what problems are. So the example here that I use is that if alcohol addiction is the problem, then the need to resolve it is ongoing sobriety. So think about it that way. So as you're identifying with your client what the problems are, then you're also looking at what the potential solution should be, and they should be a part of that process as well. Then also selecting a strategy. So being able to, after you identify the problem, and the first problem we're going to work on, is this a micro level problem? Is this something that's happening between an individual or members of his family? Is this something that's meso level? Is it happening at work or at school? Is it a macro issue? Is there something that's in the larger community that's problematic? And then start to think about the strengths that the clients bring. So clients will bring strengths to the relationship, and it's our job to really acknowledge and recognize them. So having a sense of humor, being a person who's not pessimistic, having a job, having a bright outlook on your future, loving your kids, being in a significant loving relationship with another individual who can be a source of support. All of these are strengths that clients bring. And so it's about being able to tap into and understand what those are to utilize them to help work through some of the difficult situations they've got. And then as you're looking at strategies, looking at what the client is actually capable of doing. If I've got a client who has never ridden a bus before, and we need to get them to a treatment facility downtown and they have no other transportation than the bus, then I'm probably going to have to look at a strategy that might involve me taking a day, getting this particular person onto a bus, demonstrating how to actually ride a bus, because their skill sets are not as of that. Where you may have other clients who are working in professional areas or doing other things who may have more capability. I may be able to leave a number for a client to call to set up an appointment and just give them the number and the time, and they have the wherewithal throughout whatever is going on to actually pick up that phone and make that appointment and get to that appointment. So again, looking at what your client brings to the table, looking at what the strengths are, looking at what their actual abilities are, and then starting to look at the pros and cons. So if we go and do this particular strategy, these are the things that are work well, these are the things that are going to be problematic. And then we exhaust all of the strategies that we have, and then we pick one that's going to be the most effective for that particular client. We want to be able to establish goals. So goals are the long-term outcomes that we're actually looking at. And so a lot of times people get those mixed up with objectives. Although they're very similar, they're a subset of one. So always kind of name it as like the goal, even if you think about like football, is to get into the end zone or to kick a field goal, right? So this kind of the ultimate piece is to actually score. And so when we think about like a goal here, if we've got a person who's got an issue with chemical addiction, then we're looking at a goal of increased sobriety. When we start to look at number 6, when we specify the objectives, we got to figure out like, so if the goal is to increase the sobriety, what are the steps and what are the things that we have to do to actually, what are the objectives that we got to meet to actually get to that particular goal? So you can see here, I've listed a number of different things that I would probably have this client consider doing as a way of, with the end goal of being increasing their sobriety. 7, then we're going to also look at these action steps. So we need to be specific. So we need to be able to write the particular action steps in ways that talks about who will do what, by when, to what degree. So, you will go to the treatment center and have a UA by Thursday the 9th and the expectations that your UA will be negative. So really specific pieces that you want to do throughout your course of your planning. And then after you have reached an agreement about what's in the plan, what we're going to do, what the action steps are, then we formalize it by actually either signing off on it, or there's an implied understanding, or it could be even a verbal plan that you have that establishes agreement between you and the client. It's going to lay out all the goals, all the objectives, the time frames, and the obligations, like what the client's expected to do and what you as a social worker expected to do. So that's it for your planning piece. So just make sure that as you are planning, that you hit all of those particular 8 steps to make sure that we have gotten the best information possible. So switching gears, we're going to talk a little bit about child maltreatment, because this was also a part of that particular chapter's reading. And so child maltreatment are the things that I've listed here. And it's not a completely exhaustive list, but anytime we've got children who are being physically abused, sexually abused, not being adequately cared for, not being sent to school, malnourished, abandoned, or neglected, which means that the parent is not meeting the basic needs of this particular child, then as social workers, you are an actual mandated reporter. So if you're ever working in a situation and you come across a child or you come across a family and these issues are presenting, then it'll be your responsibility to actually pick up the phone and call your local county child protective services agency and make a report. They will make a determination about whether it meets criteria and whether any services will be provided, but it does not relieve you of your obligation to actually make the report. This could be problematic because it could be a family that you're working with and you notice something that meets one of these definitions. You still have the obligation to report, even though it may have some adverse impact on your working relationship with the family. Your job is to keep the kids safe. Other things to think about as it relates to child protection or child maltreatment is that the current philosophy is family preservation. So we work in child protection in ways that keep the family connected, because research has shown that regardless of the level of abuse, up until some more egregious things like murder or rape, then oftentimes it's really good to try and preserve that family bond, because there's oftentimes some value there, but we have to do it in ways that are safe. So making sure that the issues have been rectified that cause child protection to be beginning in the first place. And then we also are planning to look at what we call permanency planning. We're always assessing risk. So we're always looking at have things changed sufficiently for a child to be safely in their home, and can they be cared for by their parent. So the permanency planning piece is that it's a time limited engagement. And so we're probably not going to work with a family for more than a year to make sure that we have things in line for that family to get back together, especially when we have children in out-of-home placement. So that kid in a foster care or living with another relative until parents get out of jail or work through whatever issues they might be having. We have to make a plan for this child to grow up somewhere permanently. So if the parents are not able to do it or not willing to do it, then we have another backup plan, which is plan B. So we'll talk more about child protection. I spent about 18 years of my career there, and it's pretty fascinating, but very tough work. Also, working with older adults. And so when we think about older adults, we're thinking about people who are considered elderly, and that's kind of the appropriate terminology that we utilize in terms of working with them, 65 and above. Things to keep in mind. That oftentimes older adults have decreased or diminished power, and that's social power or the ability to advocate for themselves. And they often are in declining physical health. So these are 2 factors that are pretty consistent with understanding how to work with older adults. Also recognizing that, for communities of color, where there are often chronic poverty pieces as well as inadequate health, that older adults have often poorer outcomes. We need to pay attention to that cultural nuance when we're working with older adults of color, because they already have some barriers that are going to have to be worked through. Strategies include adaptation, helping people understand that they are in a different place and time in their lives and their abilities might be different. Recognizing the competence that they have, or recognizing the competence that they no longer have. Relatedness, and then autonomy, the ability for them to make decisions on their own. So using the empowerment model is going to be very, very important here as well in terms of working with your older adults. Also, as it relates to your older adults, you are a mandated reporter as well. So whenever you have vulnerable adults, people who are older, who may be having mental difficulties, who may be having physical difficulties, who rely on others to provide ongoing care for them, um, financial exploitation, as well as sexual abuse are some of the things that happen to these particular adults. So if you're working with an older adult and you are concerned about their well-being or how they're being cared for, then you again are a mandated reporter and you must make a report to your county's adult protection system. Substance abuse. Very tricky. It's pretty pervasive as we think about the world that we live in right now, with some substances that were in some places actually illegal that are now legal. And so it just kind of compounds the issue. But substance abuse disorder occurs when you've got persons that are using chemicals that impair cognitive abilities, behavioral, and have physiological symptoms. So drugs, any mood altering substance. So substance abuse issue can include alcohol, cocaine, methamphetamine, any number of drugs, as well as even prescription drugs, over the counter, the opioid crisis that we're experiencing right now. So all of these are instances of substance abuse. Substance abuse becomes noticeable when people are socially impaired, when people can no longer function uh, normally or go to work or do the things that they would do that's associated with their role in their particular family or in their life. Addiction is this whole obsessive need for this continued need for this substance. You know, daily for some people, on a regular basis, they have increased tolerance, so they have to use massive amounts of drugs to reach the same piece. And then also understanding that the recovery model is one that will take some time, but it first involves abstinence. We've got to get people to put the drugs down, first of all. And that could be in an inpatient facility that's locked, an inpatient facility that's open, or an outpatient, depending on what the needs of that particular client are. Those kind of decisions are determined by the use of an assessment tool called a Rule 25 that really looks at the severity of use and what the treatment modality should be based on that. Confrontation in terms of people looking at or coming to grips with the use of the chemical and how it has impacted their families. Getting to that growth phase where they recognize that they can make different choices and they can do things different and they can live a life that's free of chemicals. And then finally, the transformation. So um, oftentimes, substance abuse counselors are specialized social workers who work specifically with that particular population and have specialized training in terms of looking at this. And oftentimes, counselors and persons who are working in these positions as social workers have often been persons who have been addicted to substances themselves. They tend to make the best counselors because they know at a very personal level about what substance abuse means and what it can do for you if it's not resolved. All right, so with that, I am done with our lecture for today. And so please make sure you read your chapters and let's have some lively discussion when we get to lab. We'll talk to you soon.